Thanks, Kelly. So we know kids are doing a lot of digital learning these days, and that can cause a lot of strain on the eyes. Dr. Scott Edmonds, Chief Eye Care Officer for United Healthcare, explains how you can reduce that risk. Let's talk about what eye strain is.
Okay, well, eye strain is a problem where you use your eyes, especially at near, for extended periods of time. When you use your eyes at near, you have to focus the mechanism inside the eye, which takes muscle power, and you have to converge your eyes to the near focus, also which takes muscle power. And locking in that power, looking at screens, which tend to be captivating, you don't look at the screen and then look away. People are locked in on those screens. They're overstressing those eye muscles. They tend to blink less. And they get a problem called digital eye strain, which is scratchy, burny, itchy eyes, or a headache, or even neck and shoulder strain from all that concentrated work. And pre-COVID, people, sure, they used a lot of screen time, but they weren't working or going to school on their screens. And so now we have work, school, recreation, texting with your friends, and especially for the millennial generation, for small children, we're concerned about all that near focus and also all that blue light. Our recent survey showed that kids are spending 13 or more hours a day on some kind of a digital device between their phones and their screens and now school. This excessive exposure sets them up for risk to overexposure to blue light. During that growth and development, if the developmental system feels that the screen is the desired focal distance, the eye will set itself to that focus, and then the child will be nearsighted. So nearsightedness has increased from, in the 70s, it was about 25% of the population, and today it's over 40%.
That is a significant spike for nearsighted vision. Now, what are the first signs of trouble we can look for?
So in kids, especially younger kids, they don't know that they're not seeing well. They assume everything is supposed to be like that. But you'll see them squinting a lot. They blink a lot. They want to sit very close to the TV. You may see eye rubbing, or you may see the child start to avoid near work or not want to read or not want to do their screen time. They fidget and they don't pay attention, not because they're hyperactive, just because they can't see or they're uncomfortable with their focus of their eyes. So parents should look for those warning signs.
And how often should a child get that comprehensive eye exam?
Well, every child should have an eye exam in their first year of life, somewhere between 6 months and 12 months of life. And at that exam, we're looking for big problems like lazy eye, crossed eyes, or congenital cataract, or other kind of developmental problems. We don't have kids reading charts or doing anything, obviously, at that age. But that's your first exam to make sure the eyes are basically sound. The pediatrician screens for a little bit of this, but doesn't always catch some of the refractive diagnoses in lazy eye and those type of things. The next exam is at about age 3, where kids are starting to pay a little more attention. We can follow tracking of their eyes, tracing, make sure that their eyes are focusing correctly. And then the next exam for children is usually when they're 5 or 6 or right before they start school, because we want to make sure at that point that the focus is clear for both distance and near. So that's where we ask them which lens is better, 1 or 2, refractive testing, to get a precise prescription if the child needs it, because we really want to assure quality vision for learning.
Dr. Edmonds added, for prevention, blue light blocking screen protectors can help. For more information, go to uhc.com. Joe?